Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Joan Buckley from the nursing department here at Nassau Community College. And today you're going to learn all about radiation therapy, one of the three main facets of cancer care. Our guest today is Chika Madu, the newly appointed chair of Radiation Oncology at Staten Island University Hospital. So, Dr. Madu, I want to welcome you to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you so much for having me. Appreciate it.
So if you want to take this time and just tell us a little bit about yourself and what made you want to specialize, and this is definitely a specialty that you're drawn to, you have to be to do this, but a specialty that works with radiation therapy primarily. What made you do that?
So I am, as you mentioned earlier, Dr. Chika Madu. I am the chair of Radiation Oncology at the Staten Island University Hospital, which is one of the hospitals within Northwell Health Cancer Institute. You know, my journey into radiation oncology is actually quite funny. When I was interviewing for medical school, one of my interviewers at University of Maryland was a radiation oncologist, and it was a field that I had never heard of before. And, you know, she brought me into the department, showed me the machines, the technology, and sort of gave me a basic explanation of radiation oncology. That sort of tweaked something in my brain, and it was, quite interesting. So I read a little bit more about it. And in my first year of medical school at University of Michigan, we had the series that we called Career Day, where different physicians will come from their different departments and talk about what they do, their different specialties. And on one of those days, Dr. Ted Lawrence, who was the chair of radiation oncology, came and spoke about radiation oncology. I went up to him afterwards and told him I was interested in finding a little bit more about the field. And that summer, I went and did some research in radiation oncology, and it was happily ever after since then.
Wow. Could you explain to the listening audience, what is the purpose of radiation therapy? I know they probably have some experience with it or some have heard it before, but could you explain the main purpose of radiation therapy? And we know, pretty much all of us know, that it's used to treat cancer. So can you just talk a little bit about that? What's the main purpose of radiation therapy? That could be confusing. Yeah.
Absolutely. So unfortunately for a lot of us, we have had some sort of encounter with cancer. If it's not us personally, then perhaps someone we know at work, someone we know from our family has had some experience with cancer. And when you get that cancer diagnosis, the first thing we do is to go speak to a physician to try to figure out what is the cancer and how can we tackle it? What stage is it at? So radiation therapy is really the use of high energy X-rays to target cancer. There are different ways of treating cancer. Certain cancers can be treated with surgery alone. Sometimes you need a combination of surgery and chemo. Sometimes you need a combination of surgery, chemotherapy, and radiation therapy. And sometimes all you need is just radiation alone, and sometimes just chemotherapy. So it really depends on what type of cancer someone is diagnosed with, the stage of the cancer, and also the status of the patient, the performance status of the patient, the treatment options that we present to a 45-year-old who's up and about versus, someone who's 90-year-old with multiple other medical problems can be very different.
I'm pretty sure I agree totally with you that everyone knows someone that's experienced cancer, and the word itself is frightening. But how do you explain the radiation? Because we know radiation from the sun is dangerous and blah, blah, blah. So most of the radiation that we know about says danger on it. How do you explain to the patient how this is going to work to help them?
I gotcha. So when I first meet a patient, it's typically in the setting of what I call a consultation. So they'll come in and we'll sit down. And before the patient comes in, I would have had a chance to go over their medical records. So I go over their prior imaging, I go over biopsies, I go over any prior surgeries that they may have had. And then we sit down and put everything together. So let's take, for instance, someone with a very early stage lung cancer, a small tumor in the lung. And for whatever reason, perhaps they have COPD and they can't have surgery. So now they're not a surgical candidate. So there's something called stereotactic body radiotherapy that I can present to this patient. Because you can't have surgery, here's an option for radiation to try to get to the point where we can eliminate this cancer as well. And the way I would explain it to a patient is, first there's a planning session. We call that simulation. And it's just basically a CAT scan within our department, and we'll have that patient laying on a flat table and immobilized in the treatment position. So we're basically simulating what it's going to be like at the time of treatment. Once we get those images, we'll use prior images that we've gotten from the patient's workup, and we map out where the cancer is. And our goal is to use the technology that we have today with stereotactic body radiotherapy to have tiny little pencil beams of radiation beams coming in from different angles, but really all convergent and targeting just that one area. And the goal is to give the optimal dose to that tumor while reducing dose to the rest of the body. Okay. So once we talk about it, we talk about side effects of treatment. And for the most part, patients are understanding of, the treatment plan. And from there on, we sign a consent form and we get started with treatment. Radiation therapy could be as short as one treatment or 3 treatments or 5 treatments, and can be as long as, 30 treatments, 35 treatments, depending on the cancer that's diagnosed.
Now, you did talk about the side effects, and you did talk about how you try to specifically aim for the tissue that you want to destroy, more or less, correct, with this very powerful radiation. Now, is anybody afraid of pain? Do people say to you, is this going to be painful? Or is it just, yeah?
Yeah, that's something we talk about. The radiation is not painful at all. It's just like getting an X-ray. So when you come in, you're laying on a table, and then the head of the machine will turn around, roll around from side to side. The machine doesn't touch you. You don't feel it. It's just like an X-ray. But for some patients who already have pain because of their cancer, that's a different story. We just have to try to control that pain with pain medication so they can be comfortable on the treatment table.
You did talk about it, and the nice thing to know is that this isn't really invasive. Can you talk a little bit about that? You did talk about how it seems to be, but how can you assure somebody that this is not going to be an invasive, where they're going to actually have limited activity afterwards or something of that nature? What kind of questions do they ask you? Maybe that's what I should be focusing on. What kind of questions do you hear from your patients about the after radiation?
Correct. So, there obviously people have concerns, like you mentioned, you hear radiation, you think danger. So one of the questions that I get asked often is, am I going to be dangerous to my family? Can I be near a pregnant woman or, a small child? Oh, my neighbor had radiation and had to go stay in a hotel for some time. So there are different kinds of radiation, and the radiation that we've talked about so far is what we call external beam radiation. So that's radiation coming from outside in using high energy X-rays. So once you get that treatment and you leave that treatment room, you are not radioactive. So you're not going to be a danger to people around you. Now, for some people, let's say someone who's got prostate cancer, very limited prostate cancer, they can get seed implants. So those are radioactive radiation implants that are actually using needles. We implant those seeds into the prostate so that over time it emits radiation to the prostate gland, and eventually the radioactive seeds will lose their power. So for patients who have that sort of procedure done, those are the patients that will ask to stay away from people like, pregnant women, little children, keep a certain distance. And then for patients who have something like cervical cancer, typically we would treat them with a combination of external beam radiation. So that's radiation coming from outside in, and internal radiation, where we put in an implant into the cervix so we can get a little bit more dose to that. But for the most part, most of these things are done on an outpatient basis, and the patient's able to go home after each treatment.
That you're making it sound really better than people probably have when they first hear that term. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau Community College, and we are learning about radiation therapy, one of the three main facets of cancer care, with Dr. Chika Madu, and she's the newly appointed chair of Radiation Oncology at Staten Island University Hospital. So they'd say Florina Russi Cancer Center at Staten Island University Hospital. Do you want to speak a little bit about what goes on there?
Excellent. Yeah. So it's very exciting right now. Currently, the way we are, radiation oncology is in one building, and then we have medical oncology in another building. And sometimes that can be difficult for patients who require chemotherapy and radiation therapy at the same time. For a lot of these patients, they may have some fatigue, and trying to truck from one building to the other, it can be a little bit difficult. So the goal of this cancer center that we're building is to be able to bring everything together in one space, so that when a patient comes in to see their radiation oncologist, they also have access to the medical oncologist in the same building. They have access to the lab space. They have access to imaging. We're going to have a beautiful pediatric cancer unit also on the third floor. We're going to have state-of-the-art infusion center there as well, both for adults and for pediatric patients as well. It's really going to be wonderful to be able to serve our patients all in one building, getting them multidisciplinary care in the same space. We started construction last year, and we're hoping to finish by the third quarter of next year, 2023.
Now, is that something that the community voiced an opinion of, like how difficult it was getting from here to there? Like when they decided to do that, I know I've seen it other places, but is that something that comes from the community, or is it something that comes from all of you people that work right there with the patients, trying to administer the best cancer care you can? So where did the idea come from? Because somebody had to really push for it.
Right, both actually. So this has been in the plans for many years, over a decade. Wow. But obviously, budget kind of gets in the way, But I think with new leadership with Northwell Health and the Cancer Institute, we knew that this really had to be done. Right, this really had to be done. We see the patients, and when a patient's done with radiation, they have to go to chemo, and you look at them, you're like, well, you're tired, right? You can't walk all the way over there. So far we have transporters that'll take them over, but it's just, I think we can do better, right? So I think everyone put their heads together, the staff here, the leadership here, and the patients are very appreciative of it. This is a $45 million project, and it's going fantastic.
Like you said, I think I said too, everybody knows somebody, or everybody may have experienced cancer at some level, and just knowing that it doesn't have to be such a chore, and it has to be achievable, getting from, like you said, from one physician to the next, or one treatment to the next in the same day. It's a monumental feat when I hear people that have to plan their treatments and things of that nature. If there's someone with a medical history besides the cancer, the newly diagnosed cancer, is there medication that they, because everybody's got diabetes and heart disease, right? So is there medications that people have to avoid, or is there like part of that medical history that you said you look at? Is there part of it that makes it a little bit different in their plan that you have to explain to them?
That's an excellent question, actually, because this comes up a lot. So sometimes patients take a lot of antioxidants. And it's, those are good, for our body. But when you sort of look at the technicalities and the physics of radiation therapy works by oxidation, right? So that's sort of the chemical reaction that happens inside the body, that the radiation causes oxidation. And that's how we try to target cancer cells. So logically, when you have a patient who's taking mega doses of antioxidants, and then we are trying to cure cancer by oxidation, they could potentially butt heads,
Oh,
correct? So typically what we would tell patients would be one dose of a multivitamin per day is sufficient while we get through the radiation. So we don't do anything that gets in the way of the the effectiveness of the radiation therapy. And then once radiation is done, they can then go about their regular regimen.
so this is really something where you have to look at each patient individually and
Absolutely.
completely. And we talk to students all the time about making sure you talk about over-the-counter medications. Everybody's trying to be healthy. We know herbs are huge. So that's very exciting. I hadn't even honestly thought of that, the antioxidant part of the thing. Now, has there anything been, since this has started and since you've been in your position, is there anything that has come up that totally threw you, said, oh, I've never seen this before. I really have to work on trying to make sure this is not included or is included in the University of Staten Island's hospital. Is there anything that came up just since you taken your position?
I wouldn't say there's anything that's thrown me, but I think what I can say is some of the big things that we've been working on very, very hard over the past year or so. Obviously, as you know, with COVID, things kind of took a back seat, right? So a lot of research, at some point we had to shut down clinical trials for a little bit, during COVID, so that we can focus our resources and our limited staff on clinical care and getting patients through their treatment. And now we've gotten back on track now with clinical trials. And our goal with this cancer center is also to be able to provide access to clinical research trials to our patients. So, we are part of the Northwell Health Cancer Institute, and our main site is in Lake Success and at LIJC, the Center for Advanced Medicine. We do have satellites all over the New York metro area. We've got satellites at Phelps Hospital, Northern Westchester, Lenox Hill, Bayshore, Huntington, here, Staten Island. And then we also have another one in Queens. And our goal is to make sure that those clinical trials reach out to all of those centers so that each and every patient who is at any of those centers has access to those clinical trials. So we've got a couple open on Friday. I've got a presentation about another clinical trial. We're going to open up clinical trials here so that all Staten Island patients do not have to get on the train, on the ferry, get on the road, sit for hours in traffic, try and seek out trials in the city when they can get the same thing here. So that's our pledge to make sure that those things are available for our patients.
That's very interesting because we know with all the healthcare disparities that treatments sometimes fall right into that same problem or piece that we have to always be aware of. And the idea of sitting on a train and having to go for some kind of therapy, whether it be anything that's going to affect me emotionally, I wouldn't want that time to sit on a train and think about where I'm going or what I'm doing. What are some of the questions, and I probably have alluded to this before, that patients ask you before they start their treatment? What are the big questions they ask you?
Some of the questions that patients have are obviously side effects. So what are the side effects? And the side effects typically are related to what we are treating. So if I'm treating a breast cancer, then the side effects would really be related to skin reaction and fatigue that's local to what I'm treating. If I'm treating a cancer that is in the belly, let's say a pancreatic cancer, then the side effects would really be related to what's in that area. So you've got bowel. So people may have some loose stools here and there, or a little bit of nausea. So we go over all of those side effects in detail, and we come up with a plan, with an action plan on how to tackle them. I make sure that I encourage them to bring it up once they notice something. And while they're on treatment, they do come every day for their treatment, Monday through Friday. At least once a week, we sit down and chat and just talk about anything. We take their vitals, we talk about side effects. Sometimes we talk about grandkids, kids in school, just because they become part of our family, right? So when someone comes to you every day for 5, 6 weeks, 8 weeks, they become family. And that's how we really get through it. I got to tell you, the patients come with an incredible amount of resolve and perseverance, and they fight. And we enjoy spending that time with them for sure.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau Community College. And today we were learning about radiation therapy and one of the three main facets of cancer care with Dr. Chika Madu. And she is the newly appointed Radiation Oncology chair at Staten Island University Hospital. This is your time. So if there was something that you wanted to leave our community with, right, our audience, what would it be?
So, I think we briefly touched on this topic. We know that we have over 17 million cancer survivors in the United States and much more beyond the United States. And that really is a testament to the amount of time and dedication that clinicians and researchers have put into clinical care and research to try to find more ways to treat cancer, to try to find better ways to treat cancer and cure cancer, medications, technology, quality of life, things like that. And I have to say hats off to all the people that make that happen. So if we make clinical research better and we answer certain questions about cancer, then we can treat patients better. We can have better cure, better treatment for patients. So one of my passions, and I work with our national organizations in this, is to make sure that while we're doing that clinical research that could potentially be life-saving, we want to make sure that we open up access to these research trials to everybody, no matter your background, no matter where you live. We got to give people access. And sometimes some of the reasons people don't get on clinical trials could be because of the design of those clinical trials. So sometimes there are certain criteria that could exclude you from a trial, not because someone is trying to really exclude you, but we're just trying to make the trial cleaner. You mentioned everybody's got diabetes and heart issues, correct?
Mm-hmm. Yeah.
So a lot of clinical trials may have that as an exclusion criteria and say, if you've got uncontrolled diabetes, uncontrolled hypertension, you cannot go on this trial. But that's the majority of a lot of the patients that we see. So our goal is to work with research organizations to try to see, can we modify the way we design clinical trials so that even if someone comes in with uncontrolled diabetes, uncontrolled hypertension, do we have the potential to control, give us a little bit of space to control those things, right? And then put that patient on trial. If you look at the United States population and the percentage of underrepresented minorities, they are not represented to that same degree in clinical trials. If you look at clinical trials, most of the patients who are enrolled in the clinical trials are going to be of Caucasian descent. You have only about 5% of minority patients enrolling in clinical trials, but they make up much more of the entire population. So our goal is to try to see if we can find ways to eliminate financial toxicities, the financial burdens that clinical trials can potentially impose on patients, to try to eliminate, those eligibility criteria that are too strict and may exclude some patients in the clinical trials. And as we work with all of these institutions, and also something like language, some of the quality of life questionnaires on clinical trials are only for patients who have English as their first language. So can we translate some of those into Spanish, right? Can we translate them into other languages so that my Russian patients can participate, so that my Spanish patients can participate in those clinical trials? It's going to take a long time. It's going to take a lot of effort. It's going to take a lot of will, but I think we can get there where when I have a clinical trial that we can present, I can say, wow, look at the percentage of patients who are enrolled in this clinical trial, and it's representative of the United States of America. That's our goal.
Northwell is always very community focused, as from what I know around on Long Island, and I'm sure it's the same in Staten Island. What kind of supportive services for the folks do that come through? Some that may have languages and different, difficulties and things like that. Where does your support come from? Does it come from inside, or do you refer people to possibly like more national organizations for support?
So we have an excellent translational service at Staten Island University Hospital, and this is true across all of the Northwell hospitals. So we have the option of a phone translation line if there's someone who comes in who doesn't speak that language, and we contract with professional translational services that will have that medical language proficiency in that person's language. We also have it's actually quite awesome. I've used it a few times, a translator on wheels, right? So we've got sort of an iPad that's on wheels, and you can actually do a video call. So you see a live, it's actually, I feel like it's much, much better than the phone translation service.
Oh, absolutely. Yeah.
Yeah, because here I'm sitting, the patient's sitting, and then there's this iPad with this beautiful screen, and you have a translator. So that translator can look at the patient and also start to read, there's something about body language, right?
Yeah.
Start to read, did you have more questions, right? So sometimes patients may hold back. They're not sure, but it gives them that opportunity to sort of see if they need to dig more to get me the information that I need.
Before you go, I do want to ask you, is there a number or someplace where anyone that's interested in more information can reach out to you?
Absolutely. Our front desk office for radiation medicine here at Staten Island University Hospital is 718-226-8862. Again, 718-226-8862. That's our front desk. And if you have any questions about radiation therapy, we'll be happy to answer. Also, on the website, if you go to northwell.edu and navigate through cancer care, the Cancer Institute has links to all of our sites that provide cancer services to patients.
That's good. Thank you for being here today, Dr. Chika Madu. Then you are the appointed chair of Radiation Oncology at Staten Island University Hospital. You really are looking at the whole picture at Staten Island. And we hope you stay safe and continue to stay healthy and continue to do the great work.
Thank you so much for having me. We really appreciate it. And, one last thing is, thank you to our patients that put their trust in us to take care of them during the toughest times of their lives. So thank you very much to our patients.
This is Joan Buckley from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.